Thanks, Jillian. And Devin, are you starting us off?
I am. Thank you so much. All right, so next slide, please. So what happens after a studio is over? That's basically what we're going to talk about really quickly. So the first things first, we do record the audio, so we definitely download that information and put it in a secure location so that we can complete our summary and recommendations. We do our best to complete our summary and get our recommendations to the researcher within a week of the community engagement studio. Now, again, we don't change what has been said by our experts, but we do check for spelling and insert punctuation when it's needed for readability purposes. Again, we send that to them within a week, along with a link to an evaluation, because we do want to get the researchers' feedback on their experience with the community engagement studio and what things we might need to improve upon. So when it comes to our experts, within the Vanderbilt system, we do Amazon gift cards. We're going to talk about compensation a little bit later. But after the studio, we communicate with them about their compensation. And we try to get that compensation to them within 3 to 5 business days of the studio, which isn't always the case, but we do our best to do it that way. And we also follow up with our record keeping in our database. So I think, as Leah stated earlier in the conversation today, we have a shared spreadsheet that we use that documents the status of each studio. So at the end of the studio, we do update that. And also in RedCap, we do have all of the information from every studio that we have ever done. And so we do update that regularly at the end of a studio with the name of the PI, the name of the study focus and population, and other information related to the study so that we can refer to it later if needed. Do we have any questions? Okay, next slide, please. So compensation. So I want to preface with compensation that it does the process can be different based on your institution. So this is just a very general summary of best practices. So first thing to consider is the type of compensation that you give. When we were in person, we would often give personal Walmart gift cards or Amazon gift cards, but since going virtual, we have had to typically send them electronically, and we have found that has been the easiest to using an Amazon gift card, but that might not work for everyone. We try to keep in mind of the population of interest and how we can have equity within the reimbursement. So for example, we recently had a community engagement studio for Spanish speakers. And several of the experts did not speak English or use their email regularly. So in that case, we used physical prepaid US bank cards and mailed it to them that had instructions in Spanish. We also, so that's one thing to think about. When setting expectations, we want to kind of determine when we should have our experts fill out their compensation form. We used to have them do it at the end. That didn't always work because it was difficult to encourage people to do it. So we figured out, how about we make it a part of the confirmation? That has made it so much easier for people to get it done and on time. So once they do it, so once they confirm their attendance by completing their compensation form, it makes it much easier to get their compensation out to them within that 3 to 5 business days. But of course, that definitely depends on the type of compensation used and your institution and whatever communication and whatever documentation they require. Something else to consider when you think about the population is many institutions require Social Security numbers. And so consider using Social Security waivers if that's the case. And that can make it easier to include individuals who might have concerns regarding identity, or including participants who might have concerns about documentation and how that might impact their ability to live and like with security. And I know that there are sometimes other challenges, so I'm going to pass this off to Meghan to give us a little bit more information.
Thanks, Devin. I wanted to just quickly talk about some of the issues that we're having, and I've seen in the chat too pretty lively discussion about how much we should be compensating. So I know we said it's 50 enough. Should it be more? And I just wanted to quickly talk about some of the issues that we've been running into. When we first started doing the studios, we found from our department that because Michigan, the way our CTSA is set up is we're matched by our med school, which is funded by in part by the revenue from our hospital. We're an academic medical center, which I know some of the CTSA, some aren't. Anyhow, that anything under $24.99 did not need to be reported to anyone. So that was our initial pilot, was just doing $20 gift cards to our local grocery store chain here, which is Meijer. And we, of course, did not think that that was enough. So we're able to pay more. And we've been running into the way our finance department wanted to do it was to set people up as individual vendors in our system, which is the same thing that you would go through if you were a speaker like a conference like this one, and you're getting paid maybe $1,000. So when you get set up in this system, it's really onerous. It's not mobile friendly. So if you're on a device like a phone, it's really difficult to navigate. It's written at a really high literacy level, so it's not user friendly at all. And to match to people's identity, they do have to give their social security number, which we're of course running into some issues with as well. So luckily we have a really supportive finance person, and we've been able to meet with our shared services department. That's the man behind the curtain, definitely, at U of M. So we've been able to meet with them to do some workarounds. And there has also recently been a call for equity out of our School of Public Health in compensation for research participants that I'm hoping gains some steam, not just necessarily for the research participants, but with paying community partners as well. So that's just, does this create obstacles? Yeah, it's creating all kinds of obstacles, not necessarily just for folks with a criminal record. We're running into issues with people being concerned about it affecting their unemployment right now with COVID, with Medicare. They don't want to have to report any additional income. In our opinion, it's just way too many hoops to have to jump through. So we're definitely trying to change it. I just wanted to jump in to say that we have had some issues, and we're hoping to get to the model like Vanderbilt where we have a social security waiver. Our institution wants to tax people who have earned over $600, which would be very difficult to do with the studios, but those are some of the issues that we're running into. And this is a soapbox issue for me, so I'm going to stop now before I go too deep down the rabbit hole here.
That's fine. Thanks, Megan. And I think the next slide is mine. Okay, perfect. So in addition to the compensation as a follow-up, the next big piece are the summary and recommendations that Devan touched on, which we try to deliver to our research teams within a week. So for example, for this particular studio, I was typing notes during the studio, and then my first step is going to be to go back, clean through those because they are very messy and my spelling is very bad. So making them, clean and nice. And then we look through those as a team and pull out recommendations. I think Tiffany touched on this earlier, but as a part of our summaries, we pull out really actionable recommendations for our study teams because the conversational summaries can be quite long. And if they're not reading through those, they may not catch what we would consider to be really clear things that they need to address as a part of their study. So just some general considerations for this. We have a template, which you'll see in just a second, for our summary and recommendations. And we pull those again specifically from the conversational summary. So they're all things that our community experts have said. They're not something where, we might have our own recommendations for the study, but that's not something we're going to add in the recommendations report unless it was specifically mentioned by the community experts. And what you see down at the bottom is sort of an example of them being actionable. So instead of saying like comprehensive social media presence might be a helpful tool for you, we sort of make them very concrete, using those good resume action words like create and develop. So again, so that they can see really clearly what the calls to action are or the action items for them after the studio. This is a relatively new element for us, but we now aggregate demographic information, some aggregate, de-identified information. So we'll list total number of folks by gender, their states, if they're coming from lots of different geographic areas, as well as their educational attainment and self-reported race and ethnicity. For our virtual studios, as you saw today, we did record. Earlier on the call, one of the research team members asked me if they were going to have access to the recording, and I said no, because we typically do not provide access to the recording for our researchers. There have only been a couple of exceptions to this, and the main exception was a pediatrician who had us recruit from her own patient population for the studio. So in that case, we checked with all of the community experts to see if they were comfortable with us sharing the recording, because these were her patients. So these were already folks who she had all of their information. And Brianna is saying their institute requires IRB to do the recording. We did ask our IRB before we had virtual studios to see if that was going to be an issue. And they said, nope, as long as they're still consultants, you're still not analyzing any of the information, you're not providing transcripts, then it still qualifies as non-research. I will say that in that very rare circumstance where we did share with the research team, we limited their access really severely. So it was only so that someone who did not attend the studio could listen in. They weren't able to download it and they couldn't share it with anyone. All right, so I think you can go on to the next slide. So I know these are sort of small, but really the key point from this slide is just that these were two of our reports from the studio that Tiffany mentioned earlier on, where we had 3 separate studios from different groups across the country for a COVID specific trial, which was called Pass It On. So I think as you can see on the left, the first group was just sort of a diverse group of folks who identified as Latinx, whereas that second group on the right was more of just a diverse group of, I believe, older adults. Yes, older adults. I'm just double checking myself. And the recommendations were really quite different. So on the left, our Latinx group really focused on relationships with doctors, relationships with hospitals, building out that trust to deal with issues, I mean, not deal wholly, but try to address issues around trust with immigration status. That was a big point that came up, as well as the need to include interpretation. Those did not come up at all in our other studio with older adults. They were more focused on being sure that you were inclusive to older adults who may not have the same access to social media or technology, so using some traditional forms of communication. So just same project, but 2 totally different groups of people and 2 totally different sets of recommendations. Alicia, you can go on to the next slide. And then finally, I think this is our last slide, just an idea of sort of the logistics. This is for more of an in-person studios because you can see that catering up at the top. I would say that's replaced by just general Zoom information. So setting up the Zoom, getting links out to people, but we do spend about 15 hours doing all of the studio itself and then the post-studio logistics. So it can be a little bit time consuming. I think people underestimate the time that's required for logistics, but to pull off a good studio, it can be a bit of time. There's a lot of work that goes into making it go well. And Heidi, I love the idea of snack boxes for virtual studios. I wish and hope that's something we'll be able to do. Alicia, you can go on to the next slide. Okay, so Megan, I'm handing it back to you, unless folks have other questions about logistics or recommendations.
Okay, I'll jump in really quick. And I know we had talked about this earlier as well about a post-studio evaluation. So there is the immediate researcher survey that goes out to our research team that helps us identify any issues that they might have had. But something that we've been considering doing, and something we do, Mishar, our institute does with other research teams that use our services, is sends out a 3 to 6 month follow-up, since sometimes those longer impacts might be a bit different. So some of the potential questions, this isn't something we have done yet, but this is something that we're working on, and I think Brianne might be able to add a couple more comments here. just how helpful was the studio on your desired outcome? How much of an impact did it have? So let's say they're in a writing a grant proposal and got some input from the experts on their grant proposal. So was it funded? Were there edits? I know one of our researchers recently is working on a PCORI, so he wanted to engage a patient. Were you able to find a patient to be on your survey or in your study? What has changed? What have you implemented from our studio? And then again, the question of, would you recommend the studio to a colleague? So Brianne, I don't know if you want to jump in. You might have a little more expertise and experience in this.
Yeah, we used to ask, we still ask these questions, and we used to have a shorter evaluation, but what we found is that the impact of studios can go on for years on a research project. And so we've included questions such as, what were the immediate changes that they foresaw in their work as far as like the long term? And then when we follow up, we ask, have you included your studio experience in any presentations or publications? Because we found that many people were sharing our work without us knowing it, and we wanted to make sure that we had a way to document that. Whether they used it for as preliminary data for a grant proposal, that's really important for us to show to our CTSI that we that our work has resulted in X amount of funding for researchers. So those are just some other questions that we ask as well.